Good evening. It is December 15th at 7 p.m. This is the North Andover Board of Health meeting, and I call this meeting to order. We will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item of business under new business is meeting dates for 2023.
All right, so you guys have these in your packet. Just want you to go through. Couple things to note. I believe the February meeting in here is during school vacation week. I know that could be a problem. So if you want to change the date, we can pick a new date now and try to make the schedules work. If anybody's gonna be away, I'm gonna have a problem with the quorum, then I think we should definitely go ahead and do that.
I'll be away.
So as of right now, we only have 4 members on the board anyway, so that, and Jen has kids. That may be a problem. Michelle, are you going away? You have
No,
kids?
I'll be here, but I could also do it the week prior.
Okay,
I can do the week prior too.
okay, good.
Yeah.
So we'll change that meeting date. What's the date on that?
The 16th. And that's not hitting any other vacations, is it?
We may have to change meeting locations, depending on if this room is already booked, but we'll try to work that out. And then April 27th, I don't know if that's, I don't think that's school week, that's the week after, so that should be okay.
Yep.
And then all the way down through the summer and the fall. You guys usually don't have a meeting in August. You can take that month off,
Mm-hmm.
okay? And then November, obviously because of Thanksgiving, we moved it to the week prior,
Okay.
November 16th, and then same thing with December of next year. December 14th versus the week after, which is Christmas week.
Okay.
All right? We will make those revisions and redo the calendar and get this ready to post for the upcoming year.
An emergency contact list.
So this is mostly for us, but we give it to dispatch in case they ever need to get in touch with somebody. Usually they start with me and then work their way down through the department. One of us is usually around and can respond. Very, very rarely would they ever get past Steve at this point.
So can you put Pat above me?
Nope, sorry. But yeah, so we'll use this for internal communications and then obviously for dispatch.
Okay.
Any changes, any issues, let me know. I can change it before we give it to them for 2023.
Sounds good.
Anybody have a bat phone they want to add to this? Special?
That would be pretty cool.
That would be pretty cool.
You should ask for one.
I have one.
Give Joe your number.
Yes. Give it to Larry.
So moving on to old business, grant updates.
All right, so as you know, we are participating in 2 grants at this point. One of them is the Public Health Excellence Grant, which you are a part of. So, actually, no, you just signed the letter for the letter of commitment. So that is the regional grant where we partnered up with 5 neighboring communities, getting money through a Public Health Excellence Grant to hire regional staff to help augment some of the capacity gaps that we have in the area. So public health nursing, inspections, grant management, trying to get everybody else in the area up to the same level. This is in the very beginning stages. Our chairperson just signed the letter of commitment to join with the other communities. The state requires this. We did just do a baseline capacity assessment throughout the region. That information and all of the inspection reports and data they requested, we submitted. It's been a heavy lift so far. Hopefully it gets lighter as things go on. But we're going to be looking to actually hire a shared grant coordinator for the region in the very near future, and we'll be housing this person here. I mean, they'll be going out to the different towns too, but we are the host community, so we get over $45,000 annually to manage the grant. So between my time and the accountant's time here, we're going to bring in a little bit of money, which is good. So it's a $300,000 grant for 3 years in a row. So we'll see how that pans out and what we can do with it.
Awesome.
The other grant you are a part of, and you are on the interview list.
Okay.
So I attached the surveys into your packets. Those went out via social media, through the different town channels. It's the community. Did you put those in there, Tony? No?
Psych.
Psych. Okay.
Sorry.
That's all right. Anyway, you saw the surveys that went out. So they went out through town social media. I got them to the youth center, got them to the library, got them to the senior center. PD sent them out. The fire department sent them out. We got 500 responses, just about, which is really good.
Is that for both communities or?
Just for us.
Oh, good.
Andover, North Andover got about the same amount each, which is good. So that's a good set of data to work with. That is one set that we're working with, obviously. The next step is now on to individual interviews and focus groups. And our chairperson is going to be an interviewee. She's also on the advisory committee for this grant, and that is getting underway. I mean, these are the beginning stages, but it's going really well so far. They're going to be doing the interviews and the focus groups throughout the month of January, and then they start to break it down and start coming up with all the different criteria we were looking at and seeing where it all falls and where it fits in. So far, so good. And that's it for the grants.
Okay. So moving on to communications, announcements, and discussions, COVID-19 updates.
So, as you guys are probably aware, we have seen an uptick in numbers. Nothing drastic or major, but it seems like the daily average is increasing. Our numbers are still, and for the last, since June, they've been in the 20s and 30s, maybe down into the teens over the summer, weekly. So right now we're 29 active cases as of today. It seems like they're becoming more steady over the past month or so. We've seen, like I said, a little bit of a small uptick. I think that was anticipated with the holidays and people moving more inside. We haven't seen nearly the spike we saw last year, which is great. I think the vaccination rates and the natural immunity has done us justice where people actually aren't catching it as much or not getting tested as much because the symptoms aren't as severe. Home testing is readily available and people know when you do test positive, you isolate and stay home for 5 days. I think the majority of people are abiding by that and knowing that they're positive aren't going to go out and risk getting other people sick. But we are seeing more, and I want to get your take on this as well, being in the healthcare industry, as to what you guys are seeing. But I'll let you talk, and then we'll get an update from Callan on our clinics and vaccinations.
I think it's actually more, so seeing more COVID in the hospital, but it's actually flu is the big really thing in the hospitals now. A lot of flu A in the hospital. And the COVID patients are actually, it's kind of a combined flu and COVID patients. And really the COVID positive patients that are critically ill or in the hospital have significant underlying medical problems too that are just making their disease more debilitating. But I'd say the more predominant thing is flu. Yeah, it's bad.
Okay.
Yeah.
I know we've heard about the hospitals closing their doors for visitors, or I've seen some things online. I heard some.
Yeah,
Anecdotal.
Lawrence General opened their doors for about 24 hours and then they shut them back down.
Okay.
And Holy Family actually has lightened up their visiting
Okay.
hours, and Lowell General, I believe, has actually lightened up their visiting hours
Okay.
as well. I think Lawrence General did that because the city of Lawrence's numbers
Mhm.
are very high, so that's why.
For everything, or just
For COVID,
Okay.
yeah. But it's like up and down as far as what the visiting hours are. But they locked it down. I'm there tomorrow, so I'll find out what's going
Find
on
out
there.
and let us know.
I got signed out and there's no COVID patients in the ICU, so.
Oh, okay. Oh, good.
Right.
How about you, Jen?
Lots of influenza A at the school,
Okay.
and there's been a cluster of COVID. I tested a teacher Wednesday, and she was positive for COVID.
Okay.
Symptomatic, yeah. And then another teacher who was with her at a party over the weekend both had it.
Okay. So, standard.
Yep.
But yeah, I was surprised to hear that they shut down visiting at the hospitals. I
Yeah,
was like, oh, okay.
I don't know the rationale behind it. People above my pay grade did make that decision, but I think it just adds to a lot of frustration and confusion when these visiting hours are changing all the time.
Gotcha.
And I don't necessarily know about the risk of transmission. I mean, everybody's required to wear masks.
Mm-hmm.
And I think it can impact just patient care and being able to see your loved ones. It just, we've been through a lot. I don't think we need this more ups and downs, kind of opening the hospital, closing the hospital, opening the hospital, things like that.
It does get confusing, actually.
Yes.
Okay. You want to give us a update on your?
So COVID and flu is about 20 to 30 cases every week. With the flu, a majority of our cases are pediatrics. We're also getting RSV cases in daycares. So the season is going to be, what do they call it? Triple-demic?
Tridemic or something?
Yeah.
Yeah.
So, but people who are sick should stay home, should wash your hands, should get tested if you feel symptomatic. For the rest of this year, we don't have any clinics planned. We're gonna wait until the holiday season kicks off, and then we'll, starting next year, probably figure out what we want to do for clinics. I do still have bivalent Moderna available. I still have flu shots available. People are still coming, just doing walk-ins, but haven't got the request large enough to host a clinic for flu or COVID.
I saw it somewhere in the news recently that the flu shots, the vaccination rate is only in like the low to mid 20s for the
Oh, wow.
nation for getting flu shots.
Huh.
So I don't know if that's contributing to because the CDC came out and said that this year's flu shot is actually matches pretty well, but the flu vaccination rate seems to be pretty low. On top of it, was already kind of predicted that it was going to be a bad
Yeah.
flu season anyway.
I think there's some confusion where people think that there is a flu COVID mesh vaccine that they're all waiting for. There is not yet. You still need to get the flu and a COVID booster. They're not one and the same.
I think we should get something out there to
Yeah.
social media saying, get your flu shot.
Yeah.
Flu is really bad. I think my son had a sniffle, so he never even got tested for anything. But I got sick, and it was the flu. So that's not fun. What did we do for numbers at the flu clinic that we did? The family flu clinic?
The family flu clinic, I think there was about, like, almost 500, right?
Wow.
Yeah, so it was a really good
In one
clinic.
night, but that's on top of all the other clinics that we've done. We went to all the senior housings, we went through all the schools to get the teachers. So that was just one night on top of, we've been hosting clinics throughout the fall.
Yep. And what was our booster clinic?
The booster clinic, I think 200 that night?
Something like that.
I think we got 200 in a night.
That's awesome.
A majority of them were younger children.
So that was the bivalent boosters we do with the Great Alarm Family Health Center at the high school, and you never know what you're gonna get. I mean, when you have a booster clinic and like 4 people show up, you're like, okay, we got 4 people, awesome. This was 200.
Last
Like-
month, we did 864.
Yes.
Yeah.
Altogether, I think, or we did like 800 flu shots, a little over 800. It's great.
Yeah, so we're working on it. I mean, we have it, it's there, we advertise it, we do it. We get what we get.
No, they seem to go well. I mean, people show up.
Yeah, no, Carolyn's done a great job with this.
Yeah.
This is awesome.
Yeah.
The fact that we got that many people in for flu and for the boosters was great. So, it was right before the holiday season too, so hopefully it helps out with people going to see their relatives and, you know, with grandma and grandpa, you know. And then, after the new year, we'll reach out and start planning another booster clinic and see what we can get. 'Cause I know they want to do another one, don't they?
Yes, I think the hard part was it was so close to the holidays. A lot of people were nervous about getting it and then being sick for the holidays or feeling lousy over the holidays. So that was kind of a deterrent towards some people, was they didn't want to potentially feel lousy if they were to get a booster.
So, we'll do that after the holidays this time. That's it for COVID-19 updates.
That's all I have on my agenda.
Alright, I do have one more thing I
Okay.
added to your packets tonight, actually. Sandbox. So, pre-COVID, one of the big epidemics we were working on was the opioid epidemic. I mean, that's been going on for years. That was our main focus 3 years ago. And then this pesky little pandemic hit. Put everything on the back burner. Everything else came to the forefront for infectious diseases and COVID and vaccinations and clinics. And this got put by the wayside. But it's still there, it's still going on. And we had a presentation from an old colleague of ours today at a seminar that we were at. And he's working on this initiative called the Sandbox. It's a cross between the Good Samaritan Law, which will protect anybody who tries to help somebody and do the right thing, with the same premise as the AD boxes we have all around town at different buildings. And this is your opioid rescue kit, basically. I don't know if this is something we're gonna look more into, but I kinda like it to get them into the community, and not necessarily like town buildings, because we have the AED kits, and I think we can even put Narcan in those and have it available. Or we can do kits like this and put these in town buildings as well. But getting them out into the community where people actually overdose. I don't know if we could partner up with restaurants and give them kits and have them keep in their kitchen next to their other emergency kits. So if anything ever happens, it's close by, it's there. It's very easy to use, and it's not gonna hurt you if you don't need it and they give it to you. It doesn't do anything wrong. So something to think about moving forward. I don't know if we can get these out there, if we
Do they
can partner up with
provide them,
anybody.
or do you have to purchase them, or-
Either through a grant, and I think most of this is done through grants, and this is, their focus is trying to get people to be able to use the opioid settlement money that towns are getting to purchase them and put it back towards the problem that we're getting the money from,
Right.
basically. So I put these in your packets to take a look at. I think it's missing a couple pages, and that was from Staples, not from us. I think the guy that had it printed up brought him to Staples, and I think they missed a page. So it is what it is. But just something to think about moving forward, some type of programming we can do and get out there into the community and see if it makes a difference.
Who would be responsible for like once the Narcan expires and switching it out and all that kind of stuff?
Haven't looked that far into it, but if we give a restaurant a kit and we give it to them for free and the Narcan expires, I think they can get it for pretty cheap, or maybe we do a replacement program.
Like track the expiration.
Yeah.
date
Yeah.
that you get.
Yeah, it
Just
could be,
put
I
out a
mean, it's not
message.
expensive. And if they want to have it on site, then couldn't hurt. If they don't want it, they don't have to have it. It's nothing, we're not going to make anybody do it. But I think if we can work with the state and use some of that opioid money and get these and give them out, there's something
Yeah.
about it. I mean,
Absolutely.
it's an epidemic that's been going on that's still there, that there's no end in sight. And I know we have our community benefits coordinators here in town that are working with us on a regular basis, daily. And let's see what we can do. Do you have any updates you want to give? Anything?
Nothing crazy. No, we're just wrapping up septic season. Mainly at this point it's just paperwork just because of the weather. And then we're doing a lot of permit renewals, dealing with complaints, general inspections, and we're working on updating the septic regs, which we're hoping to get in before next season. We're not totally sure, but that's slowly but surely coming along. And then eventually we're going to get to some local food regs too. That's about it.
We took our ServSafe recertification test this week.
Yeah.
Every 5 years, right? So yes, we did our ServSafe class and test this week. If you guys ever have any ideas or any programs you want us to look into, and something that you feel is something that the board wants to tackle, let me know. I see Jen's wheels turning.
I know, I have a question about the septic though. I read somewhere that they're changing the regulations on the septic systems. Is it just at the Cape or is it
Yeah.
all of Mass?
So from what our contracted employee Dan, who does a lot of work with Title V and different wastewater organizations, said, he said a lot of it is based on like changes to impact systems near the Cape. He said
Okay.
a lot of it wouldn't impact us. I haven't
Okay.
really had a chance to look through the changes though, because they also just put out changes to the housing regs, which are going to go into effect in April. So I kind of doubt they'd do both at the same time if it was like a massive overhaul.
You give me more credit than I deserve.
Maybe, but we'll see.
I think it has to do a lot with nitrogen loading on coastal
Yes.
areas. So nothing that we really have to deal with here,
Okay,
but the code is for the entire state. So, but what they're changing doesn't affect us at all.
okay.
We're standard, normal, conventional systems here, not dealing with coastal fluctuations and sea level, that kind of stuff.
Okay,
Yeah.
thanks.
But yeah, so the septic regs, been wanting to do that for years. I think those were done in the 90s, I think. So, yeah, those need to be redone badly. So working on those, I think we can get those done before the beginning of the spring season. Because Dan's working on them now. I'm gonna have, we'll have to advertise in the paper and have a public hearing. And then if anybody has any questions, they'll come in and run the public hearing and take any comments and then vote and pass them. But I mean, we've had them on the books forever. They just need to be updated.
Is the senior centers doing lectures again?
I don't know.
Yes. They
Yeah?
still have people come in and
Okay.
do lectures. They have someone who comes in like once a month who does like all the foot care for the seniors. They have
I'll pass
hearing.
on that.
I would.
Not your expertise.
Yeah, it's not my expertise.
They
Would you
have
like
like
to come
someone
in
that
and
comes in who does like
Yeah, I
hearing.
mean,
but-
like
Okay.
maybe in the spring or something like that. Maybe
I would love that, actually.
You do either like a lung cancer screening talk or COPD talk.
Yeah, okay.
Yes, because they have people who come in and do lectures on like caregiving as an elder. So they do a lot of lectures still. They're hopefully moving over to their new building, I heard sometime in April.
Is it April now?
So that I can do an inaugural
Yeah.
lecture.
Oh,
Yeah, there you go.
yes, I love that. Town position, Christian's the,
Yeah, I can do the ribbon cutting too. Push Melissa out of the way.
They do have a series every year where they have a whole bunch of lectures over a couple of
Yeah.
days. So that would be good for,
Oh, yeah, I remember
Yes.
Joe talking about that in the
Yeah.
past too.
Yeah.
Yeah.
that would
I
be
think
awesome.
another initiative is just, I think I brought this up in the past about having healthcare proxies
Yes.
available or even make a push healthcare proxies in the senior center too, because it's so important, just because of the way, how weird Massachusetts is for healthcare proxies, that if you can't make decisions for yourself and you don't have a healthcare proxy, you essentially have to go to court to get a court-appointed guardian, and it very well could potentially be not a family member either. But you have, even if you're married or you have kids, you don't have that little piece of paper that designates a formal
Oh, yeah.
healthcare proxy, yep.
I thought if you're married, it would go to your spouse.
Nope. In the hospital, yes.
Oh,
But
okay.
after that, like if they need rehab or a nursing home or like dementia and they can't make any decisions, it has to go to the court. So it's always just important to have a healthcare proxy, and it's a simple, like you don't need it notarized. It's just designating, you can designate one or two people,
Yeah.
and it's a signature with two witnesses, can be anybody to witness as long as they're above 18, and then you just save it.
Okay. Want to reach out to Kathy and let her know
I
that?
believe that one time they had someone come in and explain them to them.
Yeah.
I don't know if they did it there, but that's something we could definitely
Okay.
have them do if someone.
Yeah, and have the papers,
Yeah,
like blank
ready to
papers
go.
there that they can
Yeah.
do it and take it home and, yeah.
A little campaign, like.
Yeah.
They signed a
like
whole
social
little
media campaign.
entry form to get into the senior center
Yeah.
with kind of their name, emergency contact and stuff. But I know that once a month we do Senior at Risk.
Mm-hmm.
So it's a program with the fire station and the EMS coordinators that they have started trying to have people fill out like face sheets at home. So once the emergency people come in, that they have a face sheet with kind of their name, what meds they're on, medical issues they might have. But having them also do a healthcare proxy and just attach it right onto the
Yeah.
back
Yep.
would be
Okay.
pretty helpful.
Yeah.
Remember there was a, what was that, Triad project or something, where they did all your medical information in a packet and magnet on your fridge?
Yeah.
That was
They've
a
done
long
the
time ago
bottle.
though, right?
Before that, there were the ones that would go in like your freezer or your fridge.
Oh, yeah,
remember?
yep.
Like the little
Mhm.
vial something.
In your freezer?
Was it vial of life? Vial of,
Oh,
am
I
I
don't-
making that up?
Does the
Sounds good.
it does sound good.
I like
Vial of life, there you go.
We just created something.
Does the fire department have like pre-planning in there that if they go on an EMS run, that they pull up the address, they know like what their, like there's any significant medical problems or anything like that?
I think they have what they went in for previously, so only if it was a previous call, where if they fell before due
Okay.
to this, that it
Got
would
it.
pop up, but their list of
triggers,
medical
yeah.
history
Okay.
wouldn't pop
Yeah.
up. Is what I believe, I'm not a firefighter, so.
Vicki have these cards that are pockets that go on the elderly person's refrigerator. So if they have to enter someone's home, they can pull the information right off the refrigerator to find out who their healthcare proxy is, who they can contact.
Yeah, that was the Triad project.
Okay.
If, previous medical things. They're really kind of neat, and I'm pretty sure my mother got it either from the fire department or at the senior center.
Yeah, I mean, the fire department does the senior lecture series.
Okay.
Yeah.
Wouldn't mind reviving something like that and redoing it just every few years, I think.
Yep.
Yeah, not even just seniors, I mean, that's good education for everybody.
Everybody, yeah.
Yes, yeah.
I believe that's what Smart 911 is too.
Okay. Where it has all your information already pre-programmed in there?
I think you put in your information there, so it's whatever you provide
Okay.
comes in there, and I
Is
think
it
it
the-
kind of alerts for special populations, so if there was something to happen, they kind of note that these houses are special,
Mm-hmm.
and that, there's a homebound patient in this house. But I think it's more what you put in.
Is that the rave where you can register all your information in there ahead of time? I don't know either.
Yeah.
I'm not sure.
I'll have to figure that one out.
Yeah, good topics. Nice to have other things to talk about.
I know, right?
Yes, that's right.
Well, before we wrap, it is the last meeting of the year, so just wanted to make sure to pause and thank the department for their hard work over the past year and thank the board for their work. It's been a rough couple of years, so
I know.
hope you guys are able to enjoy some time off around the holidays and just thank you for all you do every day.
Yep.
Thank you.
And to Joe out there,
Good job.
he's probably watching us right now.
He could be,
Yeah,
actually.
yeah.
You know.
Yep.
Well, he's 3 hours behind, so he's
Yeah,
awake, so that's good.
yeah, exactly. That's true.
Sunny California, he's out having fun.
I know. All right, I guess I'll make a motion to adjourn.
I'll second it.
We
All
will,
right.
meeting adjourned.
All right.
All right.